and well as we get through this COVID-19 outbreak. Can you hear me?
All right. Well, thank you so much for joining us.
Excellent.
And representing our realtor community. We have a great group here, and we're going to give you the floor. You're all set.
Sure. First off, I hope everyone is safe and well.
Executive?
I can hear you. I can hear you.
Good to go.
So first off, I appreciate. Okay. Thanks everyone for the opportunity to speak with you today as I give you an update with regards to the COVID-19 outbreak in Erie County and Western New York. As you all know, we are part of the Western New York Regional Economic Development Council District, which includes Niagara, Erie, Chautauqua, Cattaraugus, and Allegheny counties as it pertains to reopening. The analysis is being done on a regional basis, looking at 7 metrics, which relate directly to hospitalizations and our ability to respond rapidly to increase hospitalization. The county, working with our hospital partners, have done a lot to increase the availability of hospital beds, as well as the work that we need to do with regards to testing and contact tracers, to the point we now have met 5 of the 7 metrics that the governor of New York State have put in place to reopen. The only 2 that we have not met are pretty much out of our individual control, but are in control of our region, so to speak, and that's hospitalization numbers. We want to see a net decline over a 14-day period, and the same thing with hospital deaths. We want to see a decline over a 14-day period, or there's a rolling 3-day average of 5 deaths or less from hospitals, which we are not meeting in this region at this point. And with the 14-day decline, we are headed in that direction, and I'm hopeful within the next couple of days we'll actually meet that standard. There's also a 3-day rolling average, which we are not yet. We have a better chance of making the 14-day decline than we do the 3-day rolling average, because we've had a significant outbreak in this region. A lot of people might not think so, but we've had more cases as a region, or just Erie County has had more cases as a county than Allegheny County, Pennsylvania, where Pittsburgh is, as well as Cuyahoga County, Ohio, where Cleveland is, in gross cases as well as deaths. And each of those counties have 300,000 more people, and generally are more dense. So this is not a joke. This is not a hoax. We actually have a real outbreak in our community. There's communities, cities that are larger than ours, counties that are larger than ours, that actually have less cases, less deaths. So we've been working very hard since basically mid-March to address this. The numbers are trending in the right direction. We're not there yet. When we do reopen, I think as you all know, it's a phased reopening. It's not one grand reopening, in which phase 1 includes construction, manufacturing, retail with curbside pickup. And when they talk about retail, they release the delineation of what retail means, and that includes more than grocery stores, but clothing stores, shoe stores, sporting goods stores, jewelry stores. They can reopen, but they can only reopen for curbside pickup. So if you've been waiting to buy that wedding ring, you can get it now through curbside pickup. But if you want to go in the showroom and take a look at it, you can't. So there's certain things that will reopen, construction and manufacturing in phase 1, once we're given the go-ahead to do that. The Buffalo News has a big article. County may partially reopen Friday based on our improved numbers. I said we may. I said the odds weren't very good, but we could. I'm not expecting us to make it for Friday, because I think we would have had to have gotten the go-ahead by now from the state. But our numbers may actually meet the protocol numbers by Friday. Then we would petition the state to reopen at a sooner date rather than 2 weeks from now. And that would be determined finally by New York State. As you know, real estate is one of the businesses that is included in phase 2, which also includes professional services, professional firms. So real estate would technically be able to reopen. This is not at full capacity. This is at partial capacity, and all employers have to have plans in place to reopen safely, plans that must be available for review by employees or members of the public if they should enter the premises. So an employer could reopen if you're in phase two, a realtor, a location where you have employees could reopen, but you have to have a plan in place before reopening. You can't do it afterwards. If you don't have a plan and you reopen and your employees or others say, hey, where's the plan? And like, we don't have one, we don't need one. They're going to call us because we've been charged with compliance to shut down those that have been reopened without plans. The state is supposedly going to release, not today, this week, the plan template that they want businesses to follow. They sort of announced what it was yesterday, the major factors of it, and you can find that on forward.ny.gov, the book that the governor released yesterday on how to safely reopen, as well as what businesses are expected to meet, which is to provide a safe location for employees, as well as patrons, if you have patrons, invitees, people you invite into your premises. So we're hopeful by the end of the week we'll be able to distribute out to all of the local businesses the template, so to speak, that needs to be followed. The governor said that it has to go on, be filed with local officials. I've also heard information from the governor's office that that is not the case, so we're trying to figure out exactly what it is. If the governor said it, then I'm expecting I'm going to have to keep a record of thousands of plans as businesses reopen. No matter what, the business has to have the plan available for review by your employees and invitees, and if you do not, you're subject to immediate shutdown once again. So for the real community, I'm hopeful that we'll enter phase one no later than June 1st. There's a 2-week time period between phase one and phase two, in which then we can move into phase two if we have statistical analysis on hospital data, deaths and the like, that shows that we haven't had a run on the hospitals. And if we don't, and the numbers are okay, then we can move into phase two. If the numbers are not good, then we have two choices. One, which is we stay at phase one until it goes down, or if the numbers are so bad, we actually go back into full pause and we shut down phase one. And then it goes like that for everything else. Phase two, phase three, phase four. So assuming the numbers are great, then we'd move into the next phase and go onward. The state still has not determined what phase places of worship are in. I think they're going to probably be in phase three. And barbershops and beauty salons, I don't know when those are going to be. They're definitely not going to be phase four, but they could be phase two, maybe phase three. But I think it's we're getting closer. We're almost there, but we're not there yet. The thing I want to remind everybody, while 55% of the deaths in Erie County were individuals who resided in nursing homes when they at least caught it, more than 55% of the people who've been hospitalized, usually it's about 65 to 70%, are those who did not live in a nursing home. They lived at home, or they lived in an apartment complex. Joe Eminger, the supervisor of the town of Tonawanda, he contracted it, and he was in the hospital for a little bit. He was released. He was supposedly recovered, and then he got it again. He didn't attract a new case in all likelihood. He still had the original case. Just goes to show that it's very difficult to determine recovery, because even his doctor released him, said, "You recovered, Joe." And he's like, "Great." He didn't do anything different. He stayed at home, and he got sick again. And that just shows what can happen with the coronavirus. It's not a traditional illness where you're not feeling so good, like the flu, and then maybe you're out for 3 to 5 days, but then you're generally stronger and better. It has some strange things associated with it. We have seen and we've gotten information with regards to deaths among younger people. When I say younger, I'm talking under the age of 50, associated with strokes. There's a number of mysterious stroke deaths we've had in this region that are not counted in our death total. And some of those individuals had not been tested for COVID-19 before they died. Based on data we're seeing from New York City, they were seeing in people under the age of 50 a problem with strokes that should not have happened with ordinarily perfect health individuals, like catastrophic strokes, not minor strokes, catastrophic strokes. And then they've done testing and they've realized these individuals had COVID-19. So there's some issues out there that I don't think are necessarily being we tried to bring up but not always been discussed, that indicate that this is a serious problem. And we're looking at the data now from the communities that opened 2 weeks ago. And they're starting to see increases in cases. Not a big surprise. Everyone expected that. The question is, how big are the increases? I'm specifically watching cases in the Midwest. I've got partners, colleagues of mine, they're colleagues from our county association that had very low totals, and then they reopened, and now their numbers are starting to go pretty high. I've got a friend of mine from Douglas County, Nebraska, where Omaha is. They were, things are great, things are good. We're starting to reopen again, and now they have some of the highest percentage of cases of growth. So we're certainly going to keep a close eye on that, working with New York State. I'm hopeful we definitely will be in phase 1 by June 1st. The only way we're not going to be in phase 1 by June 1st is if the deaths continue at the current or at the rate they were last week. Remember, you're supposed to have a 3-day of no more than 5, but as long as you're showing a decline over 14 days, you can do it. We announced yesterday for Friday night, Saturday, and Sunday, there were 30 deaths, and that's less than 3 full days. So we're not at the 5 per day death rate. So we're concerned about that, even though our hospitalization is going down. Talking to the Lieutenant Governor, infrequently, but talking to the governor. And I certainly every day I'm talking to key members of his staff who are actually going to be involved in the decision-making about whether we open or not. You may have remembered I called for us to open and go into elective surgeries about a week and a half ago. The state said no, but we were looking at the data. We thought it was safe to go in elective surgeries. And about a week later, none of the data changed. It was all the same. But the state said, okay, now you can start elective surgeries in Erie County. So Catholic Health, planes are flying over our building right now. Catholic Health is doing elective surgeries this week. Clyde is starting, and ECMC hopefully will be doing them next week. So we're headed in the right direction, but we're not there yet. I'll definitely open it up for questions before I have to run. I know you've got a few. Can you hear me?
Thank you so much, Mr. County Executive.
Donna,
I really do
maybe
appreciate
frozen.
you coming to join our realtor community. If I could just ask you before we open it up for questions, Jennifer Stevenson, who is our NYSTAR president, sent a letter out, and you're talking about plans in place, which is really imperative for us as realtors to have. We need those bullet points. We did send, Jennifer did send the letter out. I'm not sure if you were able to review it or not, but it is a plan in place for us for when we reopen with some bullet points. Perfect. What are your thoughts as far as that letter goes? And I think all the realtors here would be happy to have that in place once we are able to function in phase 2.
I think a lot of in the plan is what they're looking for, but I'm hearing they may ask for a little bit more, like assurances on how you're going to ensure the place is cleaned every day. There was even discussion about determining the square footage of a facility and how many people can be in it safely. That's why we're waiting for the template from New York State to come out to say, here's exactly what they're looking for, so everyone knows what needs to be in their plan. I think a number of the things are very important. The mask requirement certainly is. Adjusting hours, limiting the amount of individuals. But what I've been told is it's not going to be an onerous plan. It's not going to be like you're going to have to do a 20-page plan, but it is going to require that every employer is going to have to show things that we haven't, like you might not have thought of. Like if you are in a building that has an elevator, how many individuals are you going to allow per elevator? Based on the size of the elevator, it could be safely 1 person, 2 people, 4 people. Depends on the size of the elevator. So you need to know the occupancy level of the elevator. You need to know the occupancy of the building. If the building occupancy technically is 20, you might have to, they might say you got to have 50% capacity, so all your offices in that building would have to have 10. So you're going to have to, we're waiting for that template. There's a number of plans that groups have put out there. The Buffalo Niagara Manufacturing Alliance has done that. And everyone's kind of waiting to hear exactly what the state is looking for so that they can just revise whatever plans they have.
So
now, if you don't have an
Mr.
office,
Executive, if I could ask you, Mr. County Executive, we, most of us here are independent contractors. And I just saw in the chat room that their our questions are working with an individual buyer. So we need, I think we're looking at how are we going to work with the individual buyers, the list, and if everybody would stay on after the county executive leaves, I did want to go over the letter that we did send out to him. But we're looking at more. Do we need to send you more information? Do we need better protocols than what we sent? As far as, you know, we all think we can work safely with the masks and the wipes and staying 6 feet, I guess, but we're just looking for more direction. Or what direction do you need from us?
The thing, if you're working out of your home and no one's coming to your home, there's really nothing you'll need to do. As long as you're not bringing people into an establishment. Now, the issue, I think that's a big one that everyone's kind of waiting for, is what happens with like showings. How do you actually show a house? What is the liability there? And we have not received that information yet from New York State. They're working on it. And I expect that to be released as part of the run up to phase 2. So let's just give you an example. Even if we do not open on May 15th and we don't open until June 1st, considering other regions will have opened on May 15th and potentially are looking at phase 2 on June 1st, I expect all of that stuff to have been released by June 1 in preparation for whatever regions that potentially could move into phase 2. This is exactly where it's the state that is making the call on this, because they're treating everyone the same statewide. So Erie County, Western New York cannot set up separate rules than the Mohawk Valley, or for that matter, Long Island and New York City. Everything's being handled by New York State and the setting up these rules. So we're expecting to get that information in the next 2 weeks as they prepare for the earliest regions to move from phase 1 to phase 2. And I do expect them to. It's interesting, some of the North Country which is the Adirondacks, was saying, we're ready, but then they got their latest statistics and they're not. Even though they have the lowest density of individuals, they're having some issues with their hospitals. So there's some, they're going to move, some are going to move effective May 15th, with the Rochester area being the biggest one. So they need to have the rules in place for all the things that are going to open in phase 2, and that includes realtors. I don't have the answers to all those questions because we're waiting for New York State to provide them.
Thank you, Mr. County Executive. That's really what we're looking for, is how we can work. So as you read the ESD guidelines, is it, in your opinion, safe to bring a buyer to a home, an agent and a buyer?
I cannot answer that question. I don't know.
That's a question of the week. I don't
I
blame
mean,
you on that
you're
one.
relying on someone to make their home safe, and you're bringing in people who may be exposed and not know they're exposed. Remember, there's asymptomatic transmitters out there. Those are individuals who have COVID-19 who are transferring it to other people but are not showing any symptoms. We believe that's how most of the nursing home illnesses came about, is because they had staff that picked it up out in the general public and then took it into the nursing homes. Because the nursing homes have been shut down since March. So you shouldn't see new outbreaks in nursing homes now, but we do. It's got to be coming from one thing. It's got to be coming from staff. So there are asymptomatic transmitters. I don't know how you do that. And we're waiting for further guidance, which is coming not just from New York State, but the health departments. And I know the health department is very concerned about that.
Thank you, Mr. County Executive. We do agree, Buffalo Niagara
see there's lots of
Association and the
questions.
New
I
York
know
State
we're not gonna be able to get to all of
Association, we agree with virtual only. That's what we have been implementing and pushing, virtual only, not to bring buyers into the home, 100%. Also, we will get more of a plan together, maybe as the Buffalo Niagara Association can get together, our executive team, and get maybe a clear picture on how we can work safely for the future phase. I don't know if
I
anybody
see
else has
someone
any.
in here is complaining about Wegmans and dozens of other people. Truthfully, I would never walk into a Wegmans or a Tops right now. You want to get sick, go to a supermarket. We know of a lot of the transmission coming from supermarkets. They are open because they need to provide food for the general public, but I shouldn't say I never go. I go, but it's always at the off hour. I carry wipes with me. But we know a lot of the transmission has occurred in the public through supermarkets. They're open so people can get food, but it is not the safest place to be. And there's a question, why can't we show vacant houses? I don't know what the answer is. They might be able to do that. The issue is, how safe is the house? I don't know. I think I don't know what the answer is going to be. And you may be able to do that, but the question is, how safe is the house? You don't know. And we don't know at this point. This is not a hoax. I know people who've lost loved ones. I've had friends who've lost parents. And there's some serious illness out of there. The first person who had it was just released from Buffalo General and been basically in there for almost 2.5 months. It is a serious illness, and it has taken lives. We know it really strikes our older population more than others. If you are an older agent, when I say older, I'm talking 60 and older, I really have to consider how often I'm going to put myself in touch with other people I haven't been around. Because while anyone can get it, and what we're seeing is the percentages of those that we test, the 20 to 30-year-olds aren't that much higher on the contraction rate than the 70 to 79-year-olds. But the older you are, the much greater chance you have of coming down with a serious illness.
Okay, we'll take just a few more questions and we'll let the county executive get back to his work.
I see, how does Cattaraugus County compare? We've been working with Cat County. Their numbers, of course, are much less because they have substantially less individuals. We're on the phone with them as well as the other counties. We actually provided Cattaraugus County additional testing materials. Erie County had problems with testing materials for the longest time, but we finally have a strong supply of testing materials. So to allow Cattaraugus County to do more tests, we've provided them additional resources. And I know the Olean General Hospital is also doing testing. The smaller counties in general are are just have lower numbers because they have lower population and they're less dense, so it's tougher to get it. But it's not to say it hasn't occurred. One of the worst breakouts in New York State was in Steuben County, associated with a nursing home down there and one community. So just because you're in a rural setting does not necessarily mean that it's going to be a 100% safe environment. I know that's a concern that even the leaders of these communities have. They want to reopen, but they don't want people to think it's 100% safe. And too many people are like, if I live in a rural community, I'm safe. I'm not going to get it. And that's not the case. The odds are, the numbers are going to be much less as a total because of the less people and how it's much more less dense in population with people living further apart from each other. But I know they're very concerned about grocery stores in the more rural communities because it's a place, there's less of them and there's more people that will go there because they have no choice. So it's difficult, but we continue to work hard to try to address these issues and reopen as quickly as we can. So
Thank you, County Executive.
thanks to everyone.
Thank you so much. We appreciate your time and your efforts and all your hard work. And we look forward to hearing from you soon.
Thank you, Donna. Thank you, everyone. Most importantly, be safe and be well, and we'll get through this together. Take care, everyone.
Thank you very much. Peter, if you want to take, okay, the county executive is off. While I have everybody here, just for a quick minute, I just wanted to update you quickly on what we sent to the county executive. The county executive and the governor are working together along with Lieutenant Governor Kathy Hochul on getting us open. So it's imperative that he understands and she understands when we get back to work, how we get back to work. I think he stressed today how important it is for us to work virtually. I think BNAR and NISAR has beat that dead horse over and over again. What NISAR did was they put together a PAG. Our president-elect Amber Wesser was on this PAG, and they put together a letter on how to reopen us as agents in phase 2, so that they do have a plan. He spoke he spoke of, you got to have a plan. And I know that had a lot more to do with the brokers and the offices than us, but we did send him, so that you all know, we did send him a letter. He had that in his hand, talking about how we want our plans for review on reopening. And he did say that they're going to add a couple more things to it, but we will circulate this letter. It is on the NISAR. NISAR posted it on their FAQ site, but we'll circulate this letter to everybody so they can see how we talked about, and the PAG spoke of all, and this is all across New York State, all together, how we want to work together as a team, because we know we need bullet points. We need, you could see he didn't answer our question because he can't. So we need bullet points, and we're working really hard on that. We'll update you on that. We'll give you a copy of the letter. Anybody has any questions, they could, you could just put it in on the chat. Otherwise, Annette, do you have anything that you want to add?
Not at this point. I think just trying to keep up on the messages that we do send. Again, if you're not for any reason getting the emails from our news and alerts from Debbie Norman, oops, sorry about that, not the birds. Just let her know so that we can double check on the emails.
So, and just one, somebody, so you're asking questions right now. I can see about what we all want to know. What is the BNAR doing about people showing homes? We're not the police, unfortunately. We can't control what other brokers tell their agents they can and can't do. We just have to be diligent about making sure we all stay safe and keep our clients safe. We have no control over how they read the ESD guidelines. Attorneys can interpret in a wide margin or a narrow margin. And so they take the guidelines and they interpret it their own ways. There's nothing we can do about that. We can just follow our own rules from our own brokers, and the ESD guidelines and BNAR and NISAR's instructions, I think are what we should really be following. Go to that FAQ sheet. That's where you should be. You heard the county executive today, and I'm on that business task force. It is some serious stuff. You don't hear about the personal stories and the deaths. I do, and it's extremely scary. So that being said, we are trying to get things in order to keep us safe, and we will be giving him some more information. I will be updating you as well from the county task force. I want to work as badly as the rest of you, but again, we need bullet points. So we're working on that, and hopefully by next week we have accurate information, not this tiny little sentence on how we can and can't work, which is really not good. Any other questions? What's your gut saying to you, Donna? Well, Mary Jacobs, my gut doesn't really have a voice, because I think one way and the next day it's something else. I believe we'll have some kind of information by the second week of June as far as how we can move forward. This is what goes on in the task force on how we'll move forward in phase 2, only if our numbers are good. So the governor says, I don't care what goes on. I don't care about anything. You have to give me these matrix numbers, or whatever they're, metric numbers. We have to meet the numbers. If we don't meet the numbers, then all of this is mute. So those numbers have to be met. That's why staying home as much as you can is really important. I personally think bringing a buyer into a home is dangerous, as he said. I think it's really dangerous. So it's a couple more weeks, and hopefully we'll be back and have some kind of working order. When construction is allowed to start, they haven't addressed town halls being open to obtain building permits. So I don't know, Margaret Fisher, about that. I don't have the answer to that. Everything is moving so slow right now. I just don't have Joe, weeks seems like months. I know, Joe. I agree. We're also, we know we can work safely. We just need the guidelines, and that's what we're waiting for. When we spoke in the last task force meeting, it's not going to be so vague. It's going to be very specific. And I think once that happens, it's going to take such a load off our shoulders to be able to go back and function and work with bullet points and 1, 2, 3 on what we can and can't do. As agents, we follow rules, and that's what we're looking for. That's key here, and that's what I believe we'll be getting prior to working, and that's going to make everybody happy to be all on the same page. Anything else? Town Hall just posted they are opening by appointments only. Everything is going to be curbside and or appointments only. So, we're going to, as far as getting buyers into homes, that might not be something that'll be on the list. I can't guarantee what's going to be there, but it's going to be a very specific list. And, which is what we need to move forward. Anybody else out there? It's good to see everybody. Annette, go. You're on, Annette.
Just talking about that, I know we sent it out to the office managers to let them know that we do have a system clause about a viewing contingency. So if your broker hasn't mentioned it to you yet, you may want to take a look at that. Again, it's a system clause with an instinet, either going into paragraph 20 or a separate addendum, so that if somebody needs to physically see the home and you're making that part of the contract, then it's there for you. You've got the verbiage to use. It goes into the contract and more or less makes it legally necessary to be able to get the buyer into that home.
It works really, thank you. Thanks, Annette. And it works really well. I mean, I've actually used it and I was able to win on a multiple offer situation. So do check that out. It makes the playing field a little fair, much more fair for everybody. And it's done very safely and step by step. And I believe not if I'm correct, it's called COVID clause, right?
No, that's the viewing contingency. So there's two forms. The
Okay.
COVID disclosure, that's one aspect, but for the contract and then the contingency to physically view the home is called the viewing contingency.
Okay.
That's a clause. The COVID-19 disclosure is a separate form.
Okay, so the brokers may want to take a look at that along with the agents. It does help us out into getting a buyer into a home safely with the seller's permission and in the contract. So it's it works and it's safe. As safe as we can possibly get. Annabelle, Annabelle, do you want to unmute Annabelle, Peter, so she can just ask a question? And Eric, we will post it on the message of the day.
Yes, Donna. The only thing I saw when I read through that we might want to do is make some sort of stipulation in that, and I'm not saying you should or you shouldn't, that viewing would take place after attorney approval. Within 3 days after attorney approval.
Well,
And then-
Annabelle, we did talk about that, and Nancy Saya, we all spoke. You could just mute Annabelle, Peter. We all spoke about that. There is option A or B, and you have the choice. So if you want to have it prior to attorney approval, you can, but you make a good point. Now you have attorney approval, and which is I believe B, Annette, if I'm not.
I don't know if we ended up putting that in the end.
Oh, okay.
If you want to do that, then you'd have to add that in additionally.
Yep. Okay.
Which attorney approval on it.
Thank you, Annabelle. So that's a good point. If you want to add that attorney approval part in there, I believe it was on there at one point and we didn't put it on because it became a little confusing, but adding that on there, absolutely, attorney approval. It just depends, I guess, on your situation. But again, it does work, and it keeps everybody safe. And that's what we want right now, is keep everybody safe. I don't know if anybody else has any other questions. Let me just see. It's under the system clauses on internet. Will this Zoom meeting be recorded? Yes, it will be. And Peter will probably have that up on YouTube at some point today, right, Peter?
Yes, ma'am. It should be up there within an hour. It takes about an hour to decode this into an MP4 and then upload. So probably sometime later this afternoon.
Does anybody on executive have anything that they want to add? That's a no. BNAR staff. Are we all good? Everybody good? Okay, so we'll get that information out to you. We'll get the letter out to you. You can see what we're putting before the executive, county executive, and we'll keep you updated as best as we can